Good morning. Good morning. My name is Lorraine Jacobs. Mark Miller and I are co-chair of the Sunday Morning Forums. We welcome and thank you for supporting Sunday Morning Forums. For over 50 years at First Unitarian Society, Milwaukee, the Sunday Forum Lecture Series has showcased speakers. Forums are 1 hour in length and provide a presentation followed by questions. Scheduling and hosting these weekly programs is accomplished by volunteers. The presenters do not receive honoraria. The content of each forum may not always align with the viewpoint of First Unitarian Society, Milwaukee. They are meant to offer topics which can be pursued further independently. Before we begin today, I'd just like to remind you that next Sunday, April 3rd at 10:10 a.m., our topic will be the route of the Badger, a vision of Southeast Wisconsin's connected trail system, with Willie Karitis. He's program manager of Rails to Trails. Watch for details in weekly e-announcements website and reminder emails for the forum start time and locations each week. And today, we welcome the very patient Michelle Allison, who will be introduced by today's forum host, B.J. Emmerich.
Thank you very much, Lorraine, and thank you all for your patience. And I am so happy to be introducing this forum because it's I am both a senior and a person with a disability. In my case, that disability is hearing loss, and I have appreciated the county services provided for both aging and disability for some years now. Lately, we've been hearing about how they're merging, especially the websites, and we realized that would be a good time to remind us all of the services that exist for us, as well as the changes that are happening. Michelle Anderson is the Information and Outreach Coordinator. She's going to help us understand what's happening with the groups and how they serve both seniors and people with disabilities. I'll ask that while she is doing her presentation, you enter any questions you may have into the chat or hold them until after the presentation. And we will have questions both from chat and people with raised hands. So at this point in time, I give you Michelle Anderson.
Good morning, everyone. My name is Michelle Allison. I am the Information and Outreach Coordinator for Aging and Disabilities with Milwaukee County. And we're gonna go ahead and get started. In January, as BJ indicated, the Aging and Disabilities departments merged to become one under one roof. And the services really have not changed. We are there, we're working together, and we've always worked together, but now we're just under the ADRC, which is the Aging, Resource, and Disabilities umbrella. So let me give you a general overview, or I can just do it that way. All right, the health, we are all under the Department of Health and Human Services. Health and Human Services consist of aging and disability services, behavioral health services, housing services, children, youth, and family services, management services, and veteran services. Our mission is empowering safe, healthy, and meaningful lives. Our vision is together creating healthy communities. And our values are partnership, respect, integrity, diversity, and excellence. And we use the acronym PRIDE. For an overview of our older adult services, we have the Aging and Disabilities Resource Center. We have wellness programs, senior centers, senior dining, Meals on Wheels, transportation, dementia care, adult protective services, and Medicare assistance and savings programs. The Aging and Disabilities Resource Center is the first place to go to get accurate, unbiased information on all aspects of life related to aging or living with a disability. The Aging and Disability Resource Center offers information, referrals, consultation, and assistance regarding access to short and long-term care services for elders and people with disabilities in Milwaukee County. The core services of the ADRC are the information and assistance, where we give accurate and timely information regarding community resources for older adults and people with disabilities. We have our benefits specialist program, where you receive information about public and private benefits, as well as and we also help individuals obtain and retain benefits. Our options counseling is a one-on-one consultation about privately and publicly funded long-term care options to allow each individual to make the best informed decisions for his or her needs. The core services of the ADRC are our youth transition, where we staff assist students to make the transition from the school system to the adult service system. Outreach activities are coordinated with school districts, parents, and guardian groups, and education and vocational groups as well. Our dementia care specialists can connect individuals with dementia and their caregivers with services and resources available in the community. And we also have a link to our adult protective services, where an at-risk adult who is an adult who has a physical or mental impairment that restricts his or her ability to care for his own needs and who has experienced or is at risk of abuse, neglect, or financial exploitation. We are able to help them with those services as well. We have a wellness program. We are dedicated to helping older adults maintain a healthy lifestyle. And we have classes such as the Stepping On Falls Prevention class. We have Living Well with Chronic Conditions, Healthy Living with Diabetes, Healthy Living with Chronic Pain, Mind Over Matter, Physical Activity for Lifelong Success, Powerful Tools for Caregivers. We have a Savvy Caregivers class, and then we also have 2 classes that are in Spanish. We have a Healthy Living with Diabetes class and the Savvy Caregivers class. We have senior centers. They offer a variety of social and recreational, health and educational activities. Anyone who is 50 and older is welcome. Each senior center has a monthly activity guide with more details on the individual classes and events. Some of the programming has been modified due to COVID-19, but most of our senior centers are opening back up and on their way to being full service senior centers. This is a map of the count of we have 5 county-owned senior centers, as well as other senior centers in Milwaukee County municipalities. The 5 county-owned senior centers are Clinton Rose, McGovern, Kelly, Washington, and Wilson. And those are indicated in the green dots. And as you can see, there are other senior centers in orange around Milwaukee County. We have senior dining, good food with good friends. Our senior dining offers a well-balanced, hot, nutritional meal. There is no cost, but there is a suggested contribution of $3. Basic registration and reservation is needed. And each month we publish menus so that you can see what they'll be offering at the various dining sites. We also have those menus on our Facebook page, as well as accessible through our website. Congregate dining has also been modified due to COVID-19, and we are slowly but surely opening those dining centers up so that everyone will be able to eat indoors. At this time, most of our dining sites are carry out only. You pull up, they bring your meal to the car, and you drive off with it. Or you can walk up to the door and get it if you're not a driver. Anyone can come pick up that meal for you. Once you register, you would just need to reserve a meal for pickup, and someone else is able to come pick up that meal for you if you do not have transportation available. You can also pick up meals at any of our dining sites. So if you live on the north side, but you have a doctor's appointment on the south side and you want to grab your meal while you're over there, you would just look at the menu options, find out what location is accessible for you, call that location, reserve your meal, and then go pick it up. This is a map of our senior dining sites. They are spread out throughout the county. We also have specialty and ethnic sites through our senior dining out program. That is where we have a couple of vendors, and I don't know if I click on that link if it'll work, and I don't want to because I don't know if I can get back through your system. But we have a dine out program where we have Orinda, Antigua, and Daddy Soul Food Dining that cook meals at specific sites. And you can go and pick up that meal, that ethnic meal on that day. Some of them offer breakfast, some of them offer lunch, and then some of them have dinner. And I can show you those flyers later on. We have our Meals on Wheels program, which is a hot, nutritious meal that's delivered directly to your home. It is delivered Monday through Friday. It is for people who are homebound, older adults who are unable to cook meals for themselves. There is no cost once again, but there is a suggested contribution of $3. And our Meals on Wheels is a good way for someone to receive a nutritious meal, as well as connect with someone who primarily is isolated due to them being homebound individuals. The delivery driver would bring you a meal each day. It's a way for somebody to check on you, have a fresh, friendly face that would say hi. Oh, they may be able to hold a small conversation with you and just make sure that you're okay. We have transportation programs that help get adults and those with disabilities around as you get a little bit older, life gets a little bit harder. You may not want to drive. Sometimes driving makes people nervous due to our current state. It makes a lot of us nervous, regardless of your age. But we have transportation options for older adults. We have the Go Pass program. We have the MCDA transportation program. We have Transit Plus. We have volunteer drivers. And then we have transportation for veterans. Some of those services are also available to individuals with disabilities. Long-term care is ongoing assistance with basic activities of daily life, such as eating, bathing, dressing, or getting in and out of bed. As individuals age, they often reach a point when they need assistance with their long-term care. And there is something called, Next Steps, My Planning Guide, where we sit down and help you plan out what the best course of action is for you so that we can make sure that we're helping you meet your needs so that you can remain pretty self-sufficient for yourself if you're able. When you start to have problems keeping up with your home or taking care of yourself, we have options counseling, where experts who can help you understand your options and connect you with resources. We also have programs to help caregivers as they care for older adults. Sometimes caregivers deal with frustrations. They also need resources and have questions on how they can help care for the person that they're taking care of. And so those options counselors will be able to help them as well. Some of these services you may need to pay for. Others are available at no cost through the generosity of community volunteers or through public programs. How to apply for publicly funded long-term care. The first step would be to call us. You call the Aging Resource Center. We all just have one number now, 414-289-6874, and that will start off the process. Next, there'll be a functionality eligibility screening where someone will come and visit you in your home to determine what your functional eligibility is. This means they will be assessing any physical, cognitive, or memory impairments that may be limiting your ability to live independently. Next, there's a financial eligibility screening, and that process would be done. Staff would help you gather the necessary paperwork. This paperwork is then sent to the state of Wisconsin's Income Maintenance Office to determine financial eligibility. Once you are approved financially and functionally, we would have someone from our office contact you to discuss an enrollment date in one of the long-term care programs of your choice. These are the long-term care programs. Once you qualify, you would be able to pick the program that is best suited for you and that would be able to meet the needs that you have. The Aging Resource Center cannot endorse or recommend any organization, product, or service. There are 4 programs that are available: Family Care, PACE, Partnership, and IRIS. Each program is offered by multiple agencies. We have Dementia Care. If you know someone who may be suffering from memory loss, we have information and resources that can help you. We support the individual by family consultation, creating care plans. We have memory cafes, and then we have research opportunities. And in supporting our community, we have community education opportunities. We have memory screenings, individual dementia tours, and then we have training for businesses who work with older adults who may have dementia or would just like to know the signs of dementia so that they are able to assist if they notice a client exhibiting those signs. Our Adult Protective Services program helps you if you have concerns about the safety or well-being of an older adult. You would just give us a call. You would call the same general number, and that would be able to get you through to all of our services for both individuals that are older adults and also individuals who have a disability. All referrals are kept anonymous, and the areas that they provide support with are self-neglect, neglect by others, physical abuse, financial abuse, sexual abuse, and emotional abuse. So if you know anyone who may be having challenges or may be exhibiting some of these signs of abuse or neglect, please give us a call. You will remain anonymous, even if they want to call themselves to get help. We do not share that information with anyone unless authorization is given. We have our Medicare savings programs. You may be eligible for programs that can save you money. We have the Medicare savings program. We have the prescription assistance program for people who need prescription drug assistance. And there are 2 programs under that category, the Extra Help and the Wisconsin Senior Care. We also have a Medicare benefits specialist who helps individuals who have any questions on Medicare. They also are able to offer presentations as well on the Medicare savings programs that are available. Her name is Nina Yang. The Aging and Disabilities Resource Center is just a call or a click away. The phone number to reach us for any of our programs or any of the services or any resource information you need is 414-289-6874. We have our website, and at this time, our websites have not been combined yet. We are still working on combining that website and finding out what is the best way to go about doing so. And so at this time, our websites are still separate. So if you go to the county.milwaukee.gov, / aging, or you would do / DSD. And we have one email address, the ADRC at MilwaukeeCountyWI.gov. And so that is the presentation for the day. Let me see if I can share some of these resources that we have available. Hold on, let me see how I will go about doing this. I have to do a new share.
Oh,
Hold on, let me try it this way. Can you see that screen?
yeah.
That is our transportation flyer. I'm gonna try to show you a number of flyers that we have. So these are our transportation options, and all of these brochures are available on our website. So this is a more detailed flyer that gives you information on the transportation options. It'll tell you for each program that we have available, what the requirements are. We have our new transportation service is called OATS. Milwaukee County Older Adult Transportation Service. That's the new acronym that they gave it. And so it tells you what you need to qualify. And I'll just slowly page through this. I can always send this information to you, or it is accessible on our website. So in order to qualify, you have to meet the certain criteria. It tells you what's available and how to contact us. And I think there's a backside that will tell you for each program. So we have the Go Pass program that I mentioned.
Nice.
There's a reduced fare card. There's Transit Plus. And these are the other options where if you receive one of the long-term care services, you can get transportation through them. Medicaid and Title 19 has transportation services. And we have volunteer drivers through ERA Senior Network. And so that is our, say that again. That's our transportation flyer. Oh, no, we don't want to do that. And so let me see if I can pull up another one. This is, we are always looking for individuals to join our boards. The Milwaukee County Commission on Aging and the ADRC Governing Board is always looking for members. If you are passionate about the well-being of older adults in Milwaukee County, you would like to exercise leadership regarding policies, program, and funding for the Aging Network in Milwaukee. If you could bring your lived experiences, expertise, and or the voice of diverse communities and contribute to Milwaukee County's vision, values, and decision-making, consider having a position on our resource center in one of our commissions, our board, or one of our committees. And so this flyer is also on our website. If not, I can provide you either BJ or Lorraine with all of these flyers so that you can pass them out. I can drop off hard copies for you at the church as well. But these are the positions that we have. We have the Commission on Aging, where we are looking for commission members. We have the Advisory Council. We have the Nutrition Council. And then we have the various committees, the Executive Committee, the Advocacy Committee, the Service Delivery Committee, the Wellness Committee. We have our Select Committee for our senior centers. And then we have the ADRC Governing Board. And as I said, I can email you all of these and you can share them with your with the various individuals. Let me see. How can I get you the next one? If we were in person, I would have showed these to you. Coming up tomorrow, Monday the 28th, we have a Let's Talk Brain Health virtual Zoom event from 11 to 12. That is being sponsored by our Dementia Care specialists. If you want to partake or participate in that event, there is a QR code where you can sign up, and registration actually ends today, but you will be able to learn about dementia care and brain health from our Dementia Care specialist. She'll discuss the risk factors for developing memory loss, normal versus not normal aging, warning signs of Alzheimer's, ways to reduce your risk of developing memory issues, and the importance of early detection. So that is tomorrow. I will send this brochure in as well, this flyer in as well. They have Let's Talk Over Coffee. They have Dementia Care support groups. Let's see. Are you seeing the one that says Let's Talk Over Coffee?
Yeah.
So they have that every third Tuesday of the month. If you know anyone, any caregivers that need support, they have a virtual conversation where you can call in as you are now and get the support you need and talk to other people about the challenges you may be going through and how we can better assist you, or resources we can refer you to. We have the Dementia Care Caregiver Support Group. That's the third Wednesday at 1 o'clock. We have memory screenings. Tuesday, April 5th from 12 to 4. You can sign up for a free memory screening with the Dementia Care specialist. Registration is required. There's the QR code that you would use to register. If you're not familiar with using the QR code, you may be able to give us a call and we may be able to assist you with that. The QR code is fairly easy to do. We're going to be having some presentations on dementia care through a partnership with Milwaukee Public Schools. So we'll have Let's Talk Brain Health. We'll have Caring for the Caregiver, Dementia 201, which is a step above Dementia 101. And those are the dates and times. Once again, I can email you these flyers. They will be held they will be virtually through Microsoft Teams, and some spots will be available for in-person at Oasis. We have a senior leadership program. If anyone is interested in being trained as a senior leader, there's a program, there's a 2-3 day, May 10th through May 12th. There's going to be an event up in Madison, and you will be able to, as a senior leader, you'll be able to it'll help inform you about the county government and programs available for older adults. It will provide you with an understanding of legislative decision-making. It will equip you with tools and strategies to influence policymakers, and then inform you of public policy issues facing older adults today. That is May 10th through the 12th. And for more information, you would call Dan Itzikowski. He is leading our leadership program opportunities, and I will email this out as well. Want to make sure I am able to share these resources with you guys. Here's our senior dining flyer. And this is about the curbside pickup. And you just drive up, grab your meal, keep going. Reservations are required. There is a $3 contribution. And this is going to tell you just a little bit more. You choose a site, you call the site, you reserve your lunch. You fill out the registration form online or when you show up to pick up your first lunch, and then you consider making the contribution. And so here are the sites that we have. We have the Clinton Road Senior Center, Elks Lodge, Franklin City Hall, Greater Galilee Church, Hart Park Senior Center, Indian Council for the Elderly, the Lois and Tom Dolan Center, McGovern Park Senior Center, the Milwaukee Christian Center, the Milwaukee LGBT Center, the Muslim Community Center, South Milwaukee Senior Center, the United Community Center, Warnemount Kelly Senior Center, Washington Park Senior Center, West Allis Senior Center, and then Wilson Senior Center. And it also lists the locations, the phone numbers. It shows you the days that they provide meals and the time of pickup. And I believe my last flyer is going to be the Milwaukee County Executive is having Healthy County Challenges. The times have not been determined, at least I don't have them on this flyer. I believe they'll be released tomorrow. But each week almost, he's going to be having an event for people to get out and get healthy. You know, there are a variety of options within Milwaukee County. Our vision is to, by achieving racial equity, Milwaukee will be the healthiest county in Wisconsin. And these events are an opportunity for everyone to come together and participate. We have the 3K walk at Sherman Park, the hike, natural trail chairs at Weir Nature Center, the Earth Day river cleanup at River Keeper, bike ride along trails for Oak Leaf Trail, golf and adaptive golf at Hanson Golf Course. We have group exercise at Brown Deer Park, a basketball tournament at Washington Park, the beach kickoff and ride at Bradford Beach, and the ride and roll to Kite Festival at Veterans Park. And the objectives are outdoor play and recreation, health, equity, and wellness, mental health and well-being, diversity and inclusion, and opportunities and community collaboration. And so this is for any county resident, any community partner, neighborhood nonprofit groups, healthcare partners, and then challenge supporters. And so I can email all of these over, and BJ and Lorraine will be able to share them with you. Are there any questions for me?
Actually, this is BJ. I've been monitoring the chat. We don't have any in there, but I know one that I would like you to pull up if you can is the dining out option for seniors.
Okay.
Because that one is new to me. And then I have some questions, and then Lorraine will be monitoring people that are there in person. So if any of you that are online would have a question, if you want to raise your hand.
So this is the dining out. You want the senior, this is the senior dining site. Let me get
Okay, I'm sorry. I thought dining out was going to restaurants or something.
Actually, I'm gonna find that one. Let me get that one for you. Hold on 1 second. Are there any other questions that I can answer in the process?
Dennis will ask you to unmute yourself and ask the first question then.
Well, thank you, Michelle, for this presentation. I feel a little better about getting old in Milwaukee County.
That's great.
What I missed in your presentation was your slide on public long-term programs, and you mentioned, I think, 3 or 4 things. And could you go into a little bit of detail about that? I just wrote down family care partners. I don't know what the rest are. Could you elaborate on that what was on that slide?
Okay, that is our, let me just share that screen. That the long-term care, those are our long-term care programs. It's, here we go. Let me share.
Well, and while Michelle is, there, okay.
There it is. So those are the options for eligible residents. There are 4 programs. their family care program, there's the partnership program, the PACE program, and the IRIS program. And those are the 4 options. Once you are deemed qualified to participate in publicly funded long-term care, we would connect you to one of those program partners. And that program partner will be able to give you more details on exactly what they do, the services they provide. We'll make sure that those services are matching up with the services that you need. And they would assign you a caseworker at that agency or with that program partner. Various agencies run those programs. Let me just see if, no, that won't let me do it. Various agencies operate those programs. Hold on. Control.
Okay.
Let me see if it'll bring up a little bit more. So this is our website. When you go to our website, it gives you the long-term care and it tells you about planning for long-term care. Can you guys see that? Yes.
Mm-hmm.
Okay. And so when you go to our website, it'll tell you how to plan ahead. It'll show you the My Steps planning booklet and the My Way planning booklet. It'll give you more information about telling you how to enroll, which are the steps that I mentioned to you, about the functionality, the financial, and then once you're enrolled. And then here down below, it'll tell you more about the publicly funded long-term care options. And you can go to our website and click on those options, and it'll tell you about Community Care Agency and My Choice. They handle the family care services. Once the family care program, the partnership program is administered by Community Care as well, and iCare. PACE is administered by Community Care, and then IRIS is administered by Advocates for You, Connections, First Person, and TMG.
Mm-hmm.
And so if you want to get more detailed information on what those long-term care options are, you would just go to our website.
Mm-hmm.
Did
Thank
that answer
you.
your question, Dennis?
Could you say briefly what PACE and IRIS are, or should
I
just go to the
I
website?
don't really, they're just, those are the names of the programs that they give you. You would have to talk, I would say maybe go, if you go, I don't know much about the programs. I just do the outreach and information sharing. I would either suggest that you would call our number or go to the website and you can click on, let me try clicking on family care. It'll tell you community care. And let me see, there's the PACE formulary. It'll tell you about the services that they provide and what they do, what is PACE, what they do, who we serve. So once you go on, each individual agency would outline what they do for that individual program.
Okay, thank you.
Yeah, I don't know much about the intricacies of what they do. Let me go back to the dining flyer. Let me find it. Just had it. Hold on, I don't think.
Actually, I'm
Go
sorry.
ahead.
If I could interject, Dennis, my parents thankfully were able to qualify for the family care program. It was one of the early ones because Milwaukee County was one of the test sites. And it's that worked out wonderfully. And there are a number of long-term care facilities in Milwaukee. What I'm going to ask Michelle is, I noticed that on some of the slides that they're part of a brochure.
Yes.
Might you be able to send a number of brochures to our church? And then we can put them out. And I would also like to say, if anyone would like a follow-up on some of these types of programs, we could either see about scheduling a forum in the fall, or we could even do a workshop where somebody, say from Community Care, could come in for an afternoon and talk to us. I think that might be a terrific idea, because as Michelle did, I did a quick look at the website, and it doesn't have a lot of details on the other programs. So I'm thinking that Community Care might either be a speaker or a workshop that we could set up.
You can always have one of our information counselors come, our benefits counselors, or one of our information and assistance counselors come out as well. And they may be able to give you a little bit more detail. And so let me just show you the dine out flyer. These are the restaurants that provide dine out options. And as I indicated, Daddy's provides their dinners through Greater Galilee on Tuesdays and Thursdays.
Okay.
Orinda provides their breakfast through the School Sisters of St. Francis on Wednesday. And Antigua provides their lunch at their restaurant on Wednesdays as well.
Oh, that's wonderful. Great.
So that I don't have the flyer in front of me. That each month there's a menu. Let me see. Once again, anytime you go to our website, hold on, let me try to go back. Then let me share our screen. I don't know if we're getting cut off. I see some numbers. Okay, so here's our website. So we have the senior dining. You can go there and see this tab says senior dining menus. You can see whatever, this is the general menu. This is the Meals on Wheels. We try to put the next month coming up so that you can plan. Here are the ethnic menus: Elks Lodge, Greater Galilee, the Indian Council, Milwaukee Christian Center, the Muslim Center. Here are the dine out menus. So if we go to Antigua, it tells you lunch option number 1 and lunch option number 2.
Okay, great.
So,
thank you very much. And then I see Lorraine has a question. So.
okay.
Yeah, and they've been building as I listen.
Well, I think you have to turn yours off and talk over here.
Sorry, there's two computers.
Okay.
Can people hear me now?
Yeah.
I just wanted to say, first of all, that a little bragging in the River West community, we started a group for elders. It's called the River West Elders Group. And we formed about 10, 12 years ago to support each other. We found there's many older adults in that neighborhood. There was a survey done who are mostly living alone in their homes. In addition to that, we have been having activities, but of course, for the past 3 years, we haven't. There's another group, they got a grant to work on offering information for elders, and it's at the Jazz Gallery, Center for the Arts. And I'm going to recommend you to them so that, and it's for a program called OWL. It's older, wiser, and living longer. So that's another thing for older adults. We're also trying to, we're beginning a partnership with Harambe neighborhood and trying to get more people there attending the OWL program. So that's happening. The other thing is, I think this is one of the best kept secrets of things that are available for people and families in the older generation. I am wondering 2 things. Did I hear you say that if there was a particular interest in dementia, we could get a resource person from that department and have them come, and a small group could meet with that person to just, wow, okay.
You see the Dementia Care, I don't know, my screen should still be up. There's a tab here for dementia.
Yes,
And
yes.
if you go, it'll tell you all the resources they provide. You can click right
Wonderful.
on and connect with the specialist or give them a call. And there are the various classes and opportunities to support you as well as the community. And they can do business trainings or community education classes.
Do you do anything in helping people complete their end of life forms and healthcare forms?
I'm not sure if we do.
Okay.
However, we may have an agency or a partner or a resource of someone that might.
Okay.
I can't. We would probably refer you to someone like elder law or
Oh.
legal aid because of the legalities of it. You don't want to be accused of swaying someone to do something that they didn't want to do. So we would probably refer you to one of those agencies for them to help sit down and do that type of workshop with.
Okay, thank you. And just one last thing, we're watching out for people who live in River West, and there's a couple people who live by themselves, and many of us think they should not any longer do that. Seems unsafe, but they're pretty wily and they think it's fine. And is that the self-neglect category for checking on people?
Yeah.
Okay.
You would just have them fill out, you would call in anonymously, give them the address and say,
Okay.
and they would ask you questions and say, you know, what do you think is going on? You know, and you would explain the situation and why you think that it's no longer safe for them to live by themselves. And they would have someone come and investigate.
Okay. Okay. And would they still have agency as far as making decisions for themselves or just learn information, or how does that work?
I think they would probably sit down and find out what the best route is. They would connect you with one of the APS counselors. They would go over what the best route is of care for them. I'm pretty sure it is, unless they're like in a serious issue where they may be harm to themselves. I believe that, you know, maybe they would talk them into getting out of their own home and possibly moving into a senior home. I don't work in those individual departments, so I wouldn't know, but we can always have someone come on and do a presentation or workshop with you on elder abuse or our adult protective services.
Thank you. Okay.
And I like that OWL program. There's an organization called ADRC. They actually have an office on King Drive, and they have a organizer working in the Harambe community. So I'm sure she would love to come out and see how you can connect to support.
She and I have just been introduced by email now.
Good. Okay. Frida, Reb, yes.
Thank you.
And I'm showing you this Get Involved tab. If you ever need us to come out, this is where you can find, this is our information on legislation. This is where our brochures are. If you ever wanted to print out one for yourself or save it on your website, on your personal computer, you can do. We have burial assistance programs. We have all types of information out here. You just click on the link and the flyer will come up and you can save it for yourself or make copies. If you want us to come out and do outreach at an event or have a guest speaker, you can click on the outreach request form, fill it out and say, you know, I want somebody to come talk about dementia care. And that form comes directly to me, and I would contact the dementia care specialist and ask them if they are available to make an appointment with you to come out on this day or have them follow up with you on a day that works best for their schedule.
Wow. Thank you.
And that will be for any of the other ones, BJ.
Yes, actually, I would like to mention to those people who have been able to remain with us, I am especially interested in the senior leadership program that is meeting in May. So I'm going to go to the website to look that up. Lorraine, I'm wondering if we might be able to encourage someone from First Church to decide they would be interested in being our senior leadership program person, so that we could have a resource within the congregation and keep up to date with this, and then help us with any coordinations and things, maybe under the social justice initiative. But that sounds like a terrific training session.
You call me,
Michelle.
you call me, BJ, or I'll call you. We'll talk. That'd be great.
Okay, yep.
I'll
And I'll
send you
take a
all
look
of
at
those
it.
flyers.
Yeah, that's tremendous. I was also going, I don't see any other hands, and I did have a question for you that I know that you listed quite a few things that go on, such as the leadership program. Are there volunteers needed for any types of activities that you do? For example, at the senior lunches to help clean up or something, or serve, or any opportunities like that?
We don't have any options available for volunteers at our office outside of the leadership committees and things like that. But I'm sure if you reach out to the individual churches or the individual sites, they may be interested in having volunteers come in and help to help support them and some of the things that they're doing. And if your church is interested in becoming a meal site, you can be a meal site once a day. You can be a meal site twice a week. I mean, once a week, twice a week, 5 days a week, whenever, once a month. You can decide the schedule that you would like. And it's a program where we can either partner you with a provider who will cook the meals and bring them to you, or with the lead agency that provides the meals and it's dropped off to you. You serve the meals and have the seniors gather. So that might be an option if you have like a monthly senior meeting. Now that people are going back into buildings, you have an option for a monthly senior meeting. You may want to be able to provide a meal. There's a $3 contribution that's suggested but not required. So that might be an option for you as well, if you're interested in doing that, if you have the facilities for a kitchen. And it's a program that there's reimbursement for it as well. So a little way to raise a little money.
That is terrific. Yeah, if get any other follow-up questions from the people, can I just list them and email them to you? And
yes,
super.
Or you can give them my number. You can have my number, or they can call the general line.
Okay.
Okay.
That sounds great. I see Dennis might have another question to close us out here.
Okay.
Yes, I'm wondering if you have any programs for the old people that are computer and IT idiots, a bit like myself.
Funny you should say that. We do.
Oh.
Let me see. Let me share my screen again. So here we are. And I'm going to make this a little bit bigger. Let me see. Is that showing my email, or is that showing the email?
Showing your menu.
Okay, well, let's not show that. You don't want all that. Let me see if I can make it bigger and open it up in a separate screen. Oh, that's not it. SOA is an organization, is one of our, do you live close to one of our county-owned senior centers?
Live just below UWM.
Okay, so the closest one to you would probably be the Clinton Rose. And now can you see their booklet? Serving older adults?
Yes.
So this tells you about what's going on at all of their locations, and you can go to any of their locations, I do believe, once you register. And so it'll tell you the classes here. They have paint and sip, Zumba. Some of them have woodwork, but they also have one. I'm just scrolling through. They look for volunteers if you want to volunteer. They have all kind of bingo activities. Kelly Senior Center. I'm gonna scroll through this fast to try to find the one about the
there was the Rose Clinton Center. I saw computer something.
Yeah, I thought they might have had one that kind of stuck out. And this might, if you want to put an advertisement in, they have stock boxes. They have one that used to have a whole page that
Oh.
talked about, there's a
Here,
technology
wow.
fair. There you go. Technology fair is coming up. Can you see that, Dennis? You can always go back to the Serving Older Adults page, www.servingolderadults.org, then /tech connect. They have an opportunity. They have a personal tech person that can work with you one-on-one. In order to attend the 5 county-owned senior centers, you have to be at least 50. And so I do qualify to go to the county-owned senior center. And so I was looking to buy a new computer. So they have a guy that will sit down and talk you through that process. What would you like to have? What are some of the features? And suggest options for you. I was having a challenge with my my computer. You know, that pad, the touch pad that you constantly are touching it and it sends you off and messes up everything that you have. He showed me how to lock that. So they do things one-on-one. They have classes that teach you how to use your iPad, how to use a computer. There are some basic computer classes that are out there that you can learn. And so if you go to their, I don't think they'll have another ad on that, but if you go to the individual location, see when the class is offered, or call in and talk to their technology person, they'll be able to tell you what's offered and when the class is going to occur. Like BJ said, when you go up to Clinton Rose, they had opportunities for computer classes. So there it is, computer lab, need access to the lab. Then they have one that teaches you about using computers. And so it's really good classes that are offered, really nice. They have trips, travel out and about committee. They're getting back to doing a lot of traveling at the different senior centers. So yeah, I would definitely reach out to one of the senior centers I know has that option. And most of the senior centers throughout Milwaukee County have a booklet that they provide their workshops in. And I don't know what the requirements are. All of the Milwaukee County has recreation programs, and I believe that anybody can attend their rec programs if you live out of that county, you are out of that city, municipality. You might just have to pay an additional fee, but there are classes all over the place. You just look out for the senior centers or look at some of the recreation books.
Excellent. Thank you.
Thank you.
Yes, I believe those are all the questions, although while you're sharing the screen, I can't see any hands raised. So
Okay,
I can
let me
ask you to
stop sharing.
stop
I don't
sharing.
see any
There we
raised
go.
on my end.
And Dorothy, thanks for hanging in there with us as well. And Dennis and Barbara. So Michelle, this was so much wonderful information and I'm so grateful. Yes. Jazz hands. Yeah. And we'll look forward to following up on a lot of these things that you're talking about. And this has just opened the door to a lot of opportunities. So thank you so very much.
Thank you. Thank you for having me. If you want any other presentations, please let me know. I'll work with those department specialists to have them come and present.
Super. Thank you. We probably will.
All right.
Thanks to the forum committee.
Have a great day.
I hear some feedback. I don't know.